And sincere thanks for joining us today, and a very warm welcome from Unitar to this first session of our online speaker series on responsible digital health. No doubt the majority of you joining us today already have some appreciation of the huge potential of digital health strategies for improving health outcomes. Indeed, it is often cited that digital health will be a key vehicle on the road to achieving universal health coverage. However, we have seen that poorly considered, unsustainable, and irresponsible digital health products can be at best a waste of time, energy, and physical resources, and at worst risk the well-being of those whose health they were supposed to improve. Along this continuum of negative outcomes from badly designed digital health tools, the perpetuation of stereotypes, widening of digital divides, and the abuse of personal data are also key concerns. This speaker series will explore these potential pitfalls and learn what can be done to avoid them in order to develop and use digital health responsibly, focusing on the safe and sustainable application of digital technologies to address health needs and challenges. Our speakers will include renowned international experts from the United Nations, civil society, academia, and the private sector. So without further ado, I would like to give the floor to United Nations Assistant Secretary General and Executive Director of the United Nations Institute of Training and Research, Mr. Nikhil Seth. Mr. Seth, you have the floor.
Thank you, Danny, and hello to everyone who's joining us today. It's almost 5 years, more than 5 years and a month, when our presidents and prime ministers made a large number of promises to us in the form of goals and targets, which we call the Sustainable Development Goals. Looking at them again, it struck me that what's staring us in the face is Target 3.8, which talks about achieving universal health coverage, including financial risk protection, access to quality health services, and access to safe, effective, quality, essential medicines and vaccines for all. How appropriate and prescient was this in September 2015? And what we are seeing today with COVID-19 are uncoordinated, dysfunctional responses to this is a tragedy. It's a tragedy beyond belief. What have we got to do now in the years ahead up to 2030? It's clearly a focus on Target 3.8, the world's major preoccupation today, achieving universal health care. And of course, digital health is not a panacea, but it offers a great potential, especially on reaching the most remote, the poorest, the most vulnerable, in ways which does not strengthen the divides that exist in digital domain. The Secretary General had recently come up with his panel on digital cooperation, and it struck me that one of the areas that has been singled out in that has been on health, and the power and potential of digital health to look at many issues in the entire spectrum of health-related issues, starting from prevention, diagnosis, treatment, and cure. So in the entire spectrum of health issues, the potential of digital health is phenomenal. But of course, there are many things we need to keep in mind on the subject of digital health, and it's my hope that during the course of these discussions, we'll be able to explore many of these. The first is the divide and the inequalities and the lack of access for digital things which pervade our world. There are so many millions, in fact, billions of people who have no device. They have no iPhone, they have no iPad, they have no desktop, they have no television. And how are we going to reach these people when it comes to the digital divide? Billions of people don't have access to the internet. And of course, there is a stronger divide between men and women in the use of the internet. So that's the first thing we need to be conscious as we focus on digital health. How do we bridge the several divides when we think of the internet? Second, for the most vulnerable in the world, whether they're migrants or refugees or internally displaced people, older persons, young people, people with disabilities, people living in remote areas, say in the part where Alex comes from, far away in the Andes or far away in the Himalayas? How are we going to reach these people? And do we have a plan? And are we going to make sure that everything we do is going to come to these digitally remote people and living in far and far-flung areas? The digital society today has brought unbelievable benefits, but it has also thrown up many challenges, like there's so many negatives of this digital world we are in, including in the human rights area, in the violations of human rights, in all kinds of things we experience for children and cyberbullying to the dark web. There's so many negatives of the world we live in and the digital world we've created. But we have to learn how to master this super connectivity for the common good. The provision of health services is a core societal function. As patients, hospitals, doctors, and insurance companies start to rely more on digital health services, we need systems that will promote trust and security in the digital environment. We recognize in UNITAR the transformative power of digital technologies, which in the world of training and in the world of education and learning has really democratized learning. It's made our the best and the best brains in the business, the best teachers in the business, the best instructional design in the business available to everyone out there. But are we using this new democratization in the way we should to get to the people we need to reach? We in the UNITAR consider digital health and digital health education as very important catalysts to improving people's well-being and achieving this promise of universal health coverage by 2030. Digital technologies are, of course, shaping healthcare industry today, but it's also driving innovation. But the kinds of things we have today, I was seeing this wonderful program on BBC on the potential of virtual learning, of augmented reality, of 3D in simulation, and in bringing the same kinds of knowledge which we have in face-to-face training. But are we experimenting enough with these? Are we being able to use these platforms to create the virtual classroom and learning in ways that will be most conducive for the penny to drop in the minds of learners? In this context, strengthening digital capacity building can help us maximize the benefits of digital health while reducing the risks and the unintended consequences. Training and capacity building can contribute to leverage the full potential of digital technologies to improve people's health and well-being. There are so many tools and technologies and applications currently available. You touch this area of digital health and you just Google it, for example, and you come across thousands and thousands and thousands of efforts that are being made in this area. But their adoption and their potential impact is limited because of a lack of training and knowledge of how to use these platforms. As we dig through all these issues in this digital health speakers series, our objective is to initiate a global exchange of best practices and examples of good and responsible digital health strategies. How can this contribute to universal health coverage? We need to discuss what considerations need to be observed in order to develop digital health projects responsibility and with the health needs of the communities at the center. In many areas of health, community training is also a very important part of what we hope to reach. And again, I think through digital health and e-learning in this area, there's great potential to reach communities where many of the issues relating to health are best addressed. I have just touched on some of the issues which came to my mind as we start this series, and I hope at the end of the series, we'll be able to understand a little better how responsibly we can address many of these issues and go to where we want to go for the future we really need and the future we want. So thank you very much, Danny.
Thank you, Mr. Seth, for your excellent opening remarks. And you've really given a picture of what we hope to cover over this 7-episode series. Particularly, I'd like to focus in on a point you made there about capacity building and training, and it's completely relevant, and one of the most relevant points. If you can have all the digital health products you want in the world to do all these marvelous things, but without the capacity to actually use them and uptake them, then we're really not achieving anything. So I would like to now introduce my first guest speaker for the discussion, Mr. Piero Bonadeo. Mr. Bonadeo is the Assistant Vice President of International External and Regulatory Affairs at AT&T, one of the largest telecommunications companies in the world. Mr. Bonadeo has over 15 years of experience in international organizations, including the United Nations Interregional Crime and Justice Research Institute and the UN Office of Drugs and Crime in both New York and Brussels, acting as a facilitator in various negotiations on corruption, terrorism, drug policy, and international organized crime. He was also the cabinet chief in a section of the European Parliament dealing with legislative issues related to public health, consumer protection, transparency in public institutes, and the budget of the European Union. Welcome to the session, Piero, and thanks for joining us today. Telecommunications companies like AT&T obviously have a huge role to play in the digital transformation across all sectors, not just health. But I wonder if you could give us an idea of how some of the big telecommunications companies, such as AT&T, have responded to an increased demand for digital health in recent years. Over to you, Piero.
Thank you, Danny, and thank you for having me in this important event. Basically, to reply to your question, we, as AT&T, responded to the increased demand of traffic on the internet in 2 ways. The first one was basically strengthen our network and our technical capacity to deliver a stronger broadband. During the lockdown, as you can imagine, we basically see an increase in average of 20% of traffic compared to similar data in February of the last year. If you look at the increased number of internet users during the pandemic, we saw 346 million people come online for the first time in 2020. And overall, the internet user reached 4.57 billion people compared to 4.39 billion people of the previous years. So there was a huge increase in traffic, and we faced this challenge in a way that we deliver some kind of technological support and solution to cope with the increased traffic. At the same time, you see increased utilization was for work from home, work at school, and eventually for telehealth. The second kind of reply that we gave to the COVID crisis in terms of telehealth was much more specific. We came up with Vital Tech in the US, and what we noticed was basically the need for a strong broadband. I mean, fast reply in terms of gigabytes and a very solid network able to support the health services that Vital Tech was providing. So we basically deployed a stronger network in terms of telehealth, and in the way that we supported the platform that Vital Health was already deploying. So physicians can basically remotely monitor patients with vital signs, and people were more connected through video, and at the same time we expanded our support to firms that are operating throughout the healthcare space, including mobility, network, cybersecurity, and cloud services. And finally, starting from March 31st, I just want to recall that in the US, AT&T collaborated with VitalTech to offer 60 days of free telehealth services through VitalCare. So in a nutshell, what we are trying to do is working to promote some policies for the digital economy that foster the development of emerging technology like artificial intelligence and support of innovations, which will play a huge role in the continued growth and effectiveness of telehealth. So we are looking at trying to support what is happening right now with the COVID, but we look also at the future somehow to support in artificial intelligence to path the way forward on this issue.
Thank you, Piero, for that excellent overview of the role that telecommunications companies have to play in digital health, and particularly during the COVID crisis that we're currently living through. We'll come back to you a bit later in the session to drill down further into some of those issues, particularly with regards to affordable telehealth systems. And now I'll introduce my second guest for the day. My second guest is Miss Lucy Setien, who is an Assistant Director of Health Tech Innovation at the Novartis Foundation. Lucy is responsible for the strategy and implementation of digital and AI programs and works on fostering multi-organizational and intergovernmental dialogues and implementing initiatives based on best practices in digital healthcare and delivery, particularly in low and middle-income countries. Prior to joining Novartis Foundation, Lucy was in charge of the technology practice at UCB, driving strategic communications and educational programs on digital and AI. Throughout her career, Lucy has held different leadership roles with a focus on corporate strategy and business development, digital project and program management, innovation, marketing, and communications across different industries. Lucy, thanks very much for joining us today. The Novartis Foundation was founded in the late 70s, but obviously a lot has changed since then, both in terms of health needs, but crucially also in terms of technological capacity as well. How has the Foundation responded to the rise in digital health interventions over the last decade? And would you say that digital health is now one of your biggest areas of focus or focus moving forward? Thank you.
First of all, thank you, Dani and Nikhil, for this very nice invitation of today. It's a pleasure to be here, and I think the topic of digital and the work of the foundation, it's a difficult one, because when people usually ask us, is digital the focus of what you do? Well, per se, digital is not the focus. The focus is really the population health aspects of the work that we're trying to achieve in low and middle income countries. Just like anything else, technology is just a tool. But like any other tool, it can have positive sides and it can have negative sides. And it is how you implement it as part of your larger strategy that it's actually going to bring the change forward. Now, to give a little bit more flavor to what I'm saying with this, as you know, the Novartis Foundation exists already for some time, as you mentioned yourself, and we have been running a number of various initiatives and large-scale programs, which slowly over the course of the years, as you saw, the digitalization, both in the private sector, but also in the public sector, has taken place. What is actually digitalization? It is where your audiences are. It is where the people are in the end of the day. If you do not reach the people as to where they are located and on the tools which they're using on a day-to-day basis, you're not going to be able to transform anything. In the concept of what we are working on, which is health system strengthening for low and middle income countries, this means a lot. We started from more simple solutions in the space of digital communications, mobile communications, telemonitoring a couple of years ago, and slowly we are advancing towards solutions driven by advanced analytics and artificial intelligence. Now, the role of the Novartis foundations in the ecosystem is a special one because we see ourselves as having three specific roles. As you know, and you have probably seen the report that we have launched as part of the Broadband Commission, which was the report on AI in health. So the first role that we play is essentially kind of the role of the person that, well, the organization that inspires the dialogue with governments, especially governments which are trying to solve these very, very difficult population health challenges of today. And this inspiration for a dialogue is quite important because it goes over the typical conversations about budgets, and it goes towards future forward-looking policies and policy frameworks which are future-proof. COVID-19 and the very fact that we're leading this conversation online is the example of that. How are we actually going to be ready for the future? As the second part of our work, essentially, together with the different partners, for example, within the Broadband Commission, you have to think of as to how you're delivering the knowledge. When you start dialogue is the first step, but then you have to deliver examples. You have to speak about best practices, creation of new good practices, also fitting the local context of the system in which you find yourself or the interconnected systems in which the ecosystem is existing. So in other words, it means that you have to provide very specific recommendations, and this is a role that we also play. For the report which I gave you as an example, introduces a framework of six core areas which are very important for policymakers to look at in order for them to be able to even use artificial intelligence for the purposes of health system strengthening. And one of those core areas in which also UNITAR works quite vastly is essentially education and people development. Last but not least, we see ourselves as essentially one of the catalysts within the ecosystem because none of the things which we can do together can be done by one organization. And catalyst means starting the right collaborations at the right time, but for the right problem as well. Because if you're going in too many directions, if you're doing too many things at the same time, you're also lacking the focus. So we are supporting a number of public and private partnership type of projects with focus specifically around cardiovascular diseases. As you know, today is actually the World Heart Day. So that's a very good example of that because we have quite a lot of initiatives which we support as part of this. For example, the launch of the first cardiovascular data collaborative, which is essentially looking at how can you use data to help create solutions based on AI, so AI type of models supporting data-driven decision makers within governments. So essentially giving the tools to policymakers to make better their decisions and more informed. And lastly, we want to support the ecosystem of innovators by connecting the dots between investors, academia, researchers, international organizations such as UNITAR, and also the national program leads within the innovation sector. So that's maybe as a good start. Danny, over to you.
Excellent, thank you, Lucy, an excellent start. And yeah, I'll just go back to the way you started your intervention there, which was to emphasize that people and the wellness of populations should be at the heart of solutions, not the other way around. People and people's needs need to drive innovation. So we'll definitely be exploring that concept further today and also later in the series. So thank you, Lucy, and we'll come back to you shortly. So my third and final guest today is Mr. Ed Booty. Edward is the founder and CEO of Reach 52, a social enterprise building a brand new community-driven healthcare service model and supporting technology platforms to deliver healthcare services in low and middle income countries, integrating the public and private sector. Edward has worked extensively in digital healthcare, patient access, insurance and health financing, business model innovation, patient journey design, business development, and creating new service delivery approaches across developed health economies in Europe and now in Asian emerging markets. Prior to this, Edward worked for the UK National Health Service and one of the largest consulting tech organizations, Capgemini. Edward, thank you for joining us today. You launched Reach 52 in 2017, very much responding to gaps you identified in digital healthcare delivery. Could you tell us a little bit more about the motivation behind the creation of the enterprise and what you saw at the time as some of the biggest gaps in digital health delivery, and whether or not those gaps or needs have changed since, or do they remain largely the same? Thanks, Edward.
Thank you as well. Thank you, Danny, and thank you as well for the invite to Unitar and yourself. Yeah, thank you to everyone for joining as well, and hello from Singapore, where I'm now based. And yeah, two really nice opening questions, and to an extent that sort of flows on from Lucy's opening remarks as well. I guess the background of Reach 52, as you say, sort of coming up to 4-year-old social enterprise is, yeah, really a mixture of my career history. So I left university, went traveling in India, and ended up working for Novartis out of Mumbai. So obviously the organization for which Lucy is now affiliated, in one of their very early access to medicine programs. And this was 10 years ago, and it's now quite a successful large-scale private sector-led access program. But I just fell in love with the concept of social business and how big corporations such as Novartis, obviously, as well as many other pharma companies and many other businesses in general, wanted to discount their products to achieve social good. So they were willing to make their prices lower in order to increase affordability for low and middle income countries. Then did that for a while, went back to the UK, worked in digital healthcare, and we were running, very expensive consulting projects for the UK Health Service, trying to make them more digital, right? So we were trying to get people out of hospital, make care patient-centered, make data interoperable, and spending millions and millions and millions, actually billions of pounds to do that. And it was really just joining those two experiences together of why I moved to Singapore about 5 years ago and set up Reach 52. We're now in 4 markets. We're in Philippines, Cambodia, and India, with our head office out of Singapore. But it really is joining those two experiences. Can we build a digital health service for areas where there's no healthcare? So we now connect about 1,000 communities to essential health services in 3 countries. We do that through a digital platform, which I'll talk about shortly. But it really is digital first primary care from the outset in areas where there's no healthcare, at least 1 hour away from the nearest health facility. But we finance that all through building a marketplace of discounted products. So allowing private sector to offer medicines, insurance plans, and consumer health products in rural and remote areas. So the way that we're doing that is we go to these rural areas, we train 1 or 2 women in a village that gives us a sort of online to offline interface to communities, because not everybody's digital. About 4 billion people still lack access to the internet. So as much as digital health is great, it certainly doesn't cover everybody on the planet, and it certainly doesn't cover older people as well, that often have the most complex health conditions. So we train these 1 or 2 women, they collect data on health needs, we share the data with the government and design a range of targeted public health campaigns, door-to-door events, group events, screening campaigns, etc. Really looking to decentralize primary care and bring it to the village. And then we also order and distribute private sector products. And that's how we make money, although the products are discounted, generally about 20 to 50% below market rate. So bringing affordable healthcare to rural areas from both public and private sector. Key challenges, I must admit, are still the same. The way I see digital health is it has to sit on an infrastructure, and that infrastructure is digital infrastructure, the internet. 60% of our communities have no access to the internet at all. Our apps are built to work fully offline, incredibly slow, limits functionality, and just generally makes everything harder and the development more expensive and costly. So the lack of internet is the first barrier we face. Secondly, the lack of payment infrastructure. Selling affordable medicines and insurance is great. We're pretty much 100% cash based. So now we're growing, moving cash around rural areas is incredibly risky and incredibly difficult. And then lastly, yeah, it's just pure supply chain. I mean, the roads are bumpy, unpaved roads, moving products around is incredibly slow and costly. And that sort of weaker, broader digital and physical infrastructure just doesn't give a platform for innovation. So it feels like we're constantly engineering around that, which comes with more cost in an area where healthcare has to be cheaper and more affordable than ever. And certainly in the last 4 years, those three limitations have not improved at all, and we continue to engineer around them. So yeah, it's an exciting space to be in, and I'm really proud of what we've done. And certainly, yeah, it's great to see people like Novartis continuing to invest in deeper forms of innovation as well, probably a lot more than what I was doing 10 years ago. But yeah, the challenges unfortunately are still there, and certainly a barrier to digital health.
Thank you very much, Ed, and thank you also for the work that you do with Reach 52. I think it's an excellent example, and the issues you raise there really are the ones that need addressing and the ones that digital health can address. I think it's really interesting to see the way that you're dealing with internet access challenges as well. And rightly so, you should be very proud of what you've achieved. And just on the subject of access, actually, it brings me nicely on to the next theme of questions for you all. So access is obviously one of the key barriers to achieving universal health coverage. Universal means that we reach everyone. But it's also one of the areas that digital health would appear to have a great deal to offer in terms of overcoming the barriers. A rise in telemedicine for remote consultations, automated translation of public health information, drone deliveries of essential health products. These innovations all seem to offer the promise that we need to achieve UHC. However, we know that the picture isn't so black and white. And as you've rightly just mentioned, Ed, like even more than 60% of your communities you're working with don't have internet access. So of course, it's not so simple as that. And access remains a key challenge. Despite the incredible increase in cell phone coverage and mobile data provision that we've seen over the past decade, it is still true that global coverage, particularly in the most rural communities, is a way off. So I'd like to turn to Piero here and ask you how much attention big telecom companies such as AT&T are giving to these coverage gaps that still exist, and what's being done from your side to really make sure that vulnerable and remote communities are not left behind in the digital health revolution.
Thank you, Danny. This is a really interesting question and challenging question. From our perspective, closing the digital divide is one of the most important policy goals of our time. And the current global health crisis has made it all the more critical. It's never been so clear the connection between development and connectivity and digitalization. So we have a challenge, and the most important obstacle to overcome right now is really the challenge of providing broadband to all communities, including those most vulnerable and remote. So in a nutshell, we want everyone to be able to access networks that are fast and reliable so they can support telehealth technologies. And could be broadband, could be through satellite internet, whatever. But this is something that we are really paying a lot of attention and investing quite a lot of financial, quite a lot of money. Then, if we look at the Latin America, for instance, right now I think the satellite internet is the only real solution for reaching out to communities that are in remote areas of the subcontinent. On the other hand, each country will address the challenges of overcoming the digital divide in a different way. But somehow we have noticed certain policy solutions that are consistent globally and can help somehow to incentivize investment and innovation. And I'm talking about open, fair, and transparent markets with stronger rule of law, globally harmonized regulatory framework that allow for the free flow of goods, data, and people, and strong enforcement and protection of intellectual property rights and obligations. Then there are other domestic measures that play a critical role in broadband deployment, including universal service fund, competition policy, and spectrum policy. So this is key for us in a way to somehow being able to deploy the either broadband or satellite internet that is able to reach out to people in remote communities. And somehow COVID-19 crisis is also an opportunity for certain countries that have received financial support from multilateral organizations in putting digital infrastructures as something that is key for the country's development. So we are looking at the way in which governments are also prioritizing digital networks in their plan for economic recovery from COVID-19.
Thank you, Piero. And I'm glad you brought up the issue of financing and costing of effective solutions there. And it brings me on to a next question for Lucy, actually, which is regarding the affordability of digital health solutions, particularly in resource-limited settings. How can we actually ensure that digital health solutions help towards making healthcare more affordable?
Well, that's the question of the century, although I would say it's not necessarily the digital health solutions that are going to make the whole health system more affordable, but in general, technology-driven business models have this kind of promise of slightly cheaper compared to other alternative solutions providing health care and delivery on both sides. What does it mean? Most of the time when we're talking about business models which are based on purely technology-driven type of solutions going beyond the pill or beyond classic treatments, for example, then the operating costs of those kind of solutions is much, much cheaper. However, I would rather paraphrase the questions, and I was provocative enough to probably do it already before our call on LinkedIn by asking, what is actually the cost of not using technology for health system strengthening? That's the more important question, I would say, because technology, again, as a tool, and maybe an enabling tool within these innovative business models, I would say technology plays a certain role. However, it's not going to remove all the problems. Meaning, the lack of education, for example, the lack of trained health workers, which cannot maybe use a specific technology, or maybe or maybe innovators that are sitting within rural areas, future innovators, but not given the opportunity to get the digital skills, the data science skills, the engineering skills, essentially education around data, digital, and artificial intelligence, they're going to miss out on a huge opportunity to be the next innovators. So what I'm saying by all of this is essentially that governments should look beyond the pure cost of the innovation that they want to incorporate in their ecosystem, but look at the other socioeconomic determinants and values which they have to start playing with in order to move the needle when it comes to usage of this kind of technologies for health system strengthening. Education is one of them. The next aspect obviously is governance processes and structures of funding which allow for innovation to even exist in the first place. Because if the choices which a government, for example, have to make between having a health budget that goes into an immediate crisis situation and maybe a part of the budget that goes into prevention or finding alternative, more breakthrough innovation types, which tomorrow can have a much larger impact and save millions of lives, although today they seem on the surface costly, is the economic exercise which governments should be doing. I don't want to make it sound as a simple exercise, because business model innovation is not a simple exercise, but also it's an exercise requiring quite a lot of different people. Like, you know, in the classic business model canvas, which every entrepreneur uses, one of the key boxes there is partners. And this is one investment also, which can have impact in the future. If you do not have the right partners, and if your team, so to speak, is not the right team to support a specific system change or a specific solution within the whole system, which can drive change, then you're not positioning yourself in such a way that you can make something sustainable and on top of it scalable in the future, maybe to other geographies. And depending who is driving this forward, be that a national government or an international organization, or if it's a bottom up from the private sector or from the entrepreneurs world, let's say the current innovators, it can have different problems and the cost can express itself in different ways. Because what is the cost of a life of a human? That's a huge cost depending on how you look at it. You can look at it as an economic cost, but also you can look at it purely as a purely human cost, right? You wouldn't want to put a budget on such a question. Maybe that's a provocative answer as well. But yeah.
Okay, no, I agree. It's provocative, but it's also completely getting to the heart of the issue. You know, it's often the case with these things that the value is not inherently obvious. It's the saving that you make that you have to look at. And I also really like the point you made about creating an environment that nurtures innovation. I think it harks back to what Ed mentioned in his opening remarks about oftentimes in the communities that he's working in, there's just not space or time or capacity to think about innovating because they're just so responsive to the issues that you're having to deal with on a daily basis. But I would like to know from Ed, obviously we heard a little bit about some of the solutions you're using in areas where internet access might be limited or it's intermittent. And that is using a community hub or a single person that relays information to the rest of the community. I just wondered if you could define a little bit more some of the other kind of low cost and low tech heavy solutions that are used in these communities, which are suffering from a lack of connectivity and a lack of resource.
Yeah, it's interesting. I mean, that's a really big question. I mean, low tech solutions. If you imagine you're in an area with low to no healthcare, you haven't really ever accessed healthcare. Your parents never really used to get healthcare either in a traditional, you know, seeing a doctor, getting Western medicine sense. The default option for healthcare access is do nothing and wait until it gets really bad and then travel to a hospital. A lot of herbal healers and quack doctors, or self-medication through family advice, really. So going to your mother or your friend or whatever. And we see a huge, and I guess the low-tech innovation actually is just incredibly bad quality, not real healthcare, actually. That said, if you are talking about, so that's, and people always say who are our competitors as Reach 52, who else is doing what you're doing as a startup, I guess, if we think of ourselves as that, not just a social enterprise, and sort of say, well, actually, it's just bad healthcare is our main competitor, and that's what we're trying to dislodge. And that's certainly, yeah, the low tech default for these incredibly hard to reach communities that are many hours away from a doctor or nurse. But then, yeah, I mean, I guess it depends on country, firstly. But Philippines, I'm still shocked at how many people have Facebook. It's staggering that the internet connectivity can be so bad. Yet when people do travel and do connect, it is to Facebook Messenger a lot of the time, and that's to speak to friends or family or overseas Filipinos, obviously working in other countries. And by far one of the biggest channels we're using now is certainly Facebook Messenger and Facebook ads. We've launched COVID chatbots. We run COVID ads. We've partnered with Facebook on that, actually. Yeah, it's an incredibly effective means of geo-targeting public health messaging. Facebook is often paid for free by the telcos to the AT&T point in a way. The telcos are often, you know, top up your phone and you have free Facebook Messenger for a month or whatever the deal might be on a phone credit-based economy. And we found that incredibly effective and scalable in times of COVID to do symptom check-ins, get health information, and so on and so forth. Beyond that, SMS, of course, is widely used. I know Novartis have done some great programs with SMS for Life, which we've spoken to them about before. But beyond that, I think it's still an incredibly paper-based economy in the parts of the world where we are really. Electronic medical records are often talked about but not really implemented. If they're nationally mandated, they often don't work because the internet connectivity is so sporadic. And yeah, the default is just sort of, yeah, paper, to be honest. And that's obviously what we're trying to change and what we're trying to make a difference in by really, yeah, engineering some of the sorts of limitations of this environment and just sort of accepting them and just saying, well, we have to build for the oldest versions of Android and we have to build to work offline and intermittent syncing, just because that's the only way you're going to make a little step forward in the right direction. But almost to sort of build on, in a way, Lucy's point as well. I mean, what we're finding is you also take a short-term productivity hit, because if you think about community health workers, they're often older, they're not the you know, the youngest, best qualified clinicians ever, right? They'd often migrate to the cities, so you sort of a brain drain of the better health workers in many ways. Obviously there's many great ones, but a lot of them go to cities. And if they're used to using paper, we try and get them to use digital. I mean, we almost make their lives so much harder. It's like, come on, like, we're using paper, it's quicker. Now, why are you making me use this stupid phone? It's so hard. And sync from time to time. I'm just used to having my paper records. So yeah, we're trying to do low tech digital, but there's actually certainly a short-term issue when you try and actually migrate and help people's skills evolve, linking to the training point of earlier as well. And that has to be factored into any yeah, innovation journey, I guess.
Thank you, Ed. And again, you've highlighted a huge number of challenges within the digital health sphere. And I think one of the key ones from your message there is appropriateness of solutions. You know, one size is not fit all in any scenario in digital health. But I would just, I realize time is moving fast. So I just have one final question for all of you. We've talked a lot about challenges today, and maybe the always the risk of being pragmatic in such a field is that you sound pessimistic or negative. I still think there's a great deal of reason for hope with digital health and the future of healthcare. And I'd just like you all to say succinctly what you see as the biggest opportunity for digital health and in the near future. And then we will head to Mr. Alex Mejia, my boss, and the Director of the Division of People and Social Inclusions for closing remarks. Thank you. Piero, if you'd like to start, and then we'll go to Lucy and Ed, and then to Alex.
While Piero begins, Lucy, any final thoughts on that?
Well, I would say maybe it's my subjective view, but given the situation in some countries where there is such a huge health worker shortage and the fact that the cost of health care and delivery is, you know, tripling, if not more over time, I would say the biggest opportunity, especially on the side of artificial intelligence, would be to create such kind of solutions that can support the health workers and close this gap, let's say, between the patients and the health system for things which simply there isn't enough capacity in the field to support that on one side, but also on the other side, even if there is capacity to provide these kind of tools to doctors and nurses, which can help them take better and more precise and faster decisions when it comes to treatment and diagnosis.
Thank you. Ed?
Yeah, actually, oddly similar point. I always think there's two ways the technology can work. One is it becomes a funnel, or you increase demand for an already resource limited health service. That's what we started doing. Go to the rural areas, connect the people, connect them to health service. Oh wait, there's no doctors. And even if there was 1 million more doctors today in the Philippines, they're not going to nice and evenly distribute across the rural areas. They're still going to centralize in urban areas. So the one thing digital health cannot become is a funnel, you know, to increase demand on an already incredibly resource limited system. That's the problem digital health will provide, in my view. The solution is, yeah, task shifting, to Lucy's point. There's lots of health workers, so we have one doctor for 100,000 people in one of our sites, where there should be, you know, at least 10, if not 100 doctors if we were in a city. So we're 10 to 100 times too few doctors. But there's about 200 community health workers in that same geography. The only way we're going to achieve universal healthcare is to empower them more. That won't be through training. Obviously, if we sent them on a full training course for everything, we'd be training them to be a doctor, and that's not going to work, right? We can't train all health workers to be doctors, obviously. So the only way is, in my view, using tech to support them in the moment, to support patients when they're with patients, to provide real support, and AI and digital has a huge role to play in that. If they're simply a funnel, the traditional healthcare providers, we're just going to create a pressure or a new massive issue and amplify the lack of human health resources, and specifically doctors. I couldn't agree more. And then the final point, I think, is data and moving to outcomes. Again, if we look at, I always think we have to look at what modern health, not modern actually, I would call them developed health systems with many, many problems are trying to move towards. Let's look at the States and the UK. It's about shifting from activity to value or to outcomes. So I think as we help lower income systems develop, we have to try and help them develop into what the more developed systems are trying to become. And that's obviously real world evidence, that's paying for performance, that's paying for outcomes. We talked about the economic arguments of human lives earlier, and all this argument is hugely true. And tech has a role in creating that data, monitoring outcomes, and really allowing different investment decisions to be made by governments as we look to pay for making health better, not just for transactional activities, I guess. But yeah.
Indeed. Thank you. Piero? I think Piero is having some difficulties connecting, but that's quite all right. Before we run out of time, I would like to leave you with a couple of ideas. And because we all know that we have to make this really compelling, and we have to make this really personal, so as to mobilize as many people as we can, as to actually portray the urgency behind it. Let me just share that I come from Ecuador in South America, that the COVID pandemic devastated my country. It still is doing that, is creating havoc. And one of the few things that have actually worked with the help of several multilateral organizations and so on is applications of technology to somehow identify what they call in Spanish the hot pockets of infected people. We saw that it's very difficult to coordinate between a national or federal government, a subnational government, the province or the state or department, and then the local community or the municipality. And I simply wanted to bring this to your attention to tell you that all what we have described today, and more important than that, the things that we will be discussing ahead, are practical. They literally can save a life or many. And that's what I have seen in the last 6 or 7 months. The application of technology in public health actually makes a difference. And on the whole ecosystems of digital health, we are very happy to have Dr. Danny Sheed with us, leading this new initiative, its conception, its design, because the one thing that perhaps we haven't explored too much in this webinar, we will ahead: public policy and digital health. How is it that we are going to knock on the doors of governments, we as the UN, we as UNITAR, and create a compelling case, so especially developing nations governments see the opportunities that you see, the ones that you know, the ones that you're actually implementing. Don't be so sure that they see them. And it's a pity. I used to be one of them, and that's why I say, because you see, it's always this terrible dichotomy between what is important and what is urgent. Everything is urgent in a nation that has a scarcity of resources, financial, human, technical, and so on. So this sometimes is seen, which is myopic. I used to make a mistake, is seen as something desirable, very appealing and so on, but impossible to achieve. No money, no capacity, no donors, no guidance, no advisors, and so on. So that's a fallacy. And with these webinars, even if we do it one person at a time, or 10 or 100 at a time, we at UNITAR are committed indeed to try to bring to the attention of government officials and civil society as a whole, including the community leader or the health working at the community level, to understand what really is the potential of digital health and how to do it to avoid the pitfalls that Danny mentioned at the beginning. So I simply want to say thank you to all of you. Of course, I have to give the commercial after our Assistant Secretary General mentioned it in passing, the Sustainable Development Goals and the fight against poverty and the fight to increase the standard of living and better education and better health and better infrastructure and better or more sustainable transportation, the fight to protect the environment, all of these things during COVID have decreased. All these efforts have been diminished for obvious reasons. In the global north, in the global south, even in rich developed nations, combating this pandemic has really drained the resources. And you can imagine that in countries like mine, or countries in sub-Saharan Africa, or in East Asia and the like, especially in the small island developed states and least developed countries, the fight against poverty, the quest to create public health systems that are better, more resilient with quality of service, the use of technology, the adoption of digital health policies and programs and projects and so on, are unfortunately lagging behind. It's a pity, but we must remain optimistic, and I didn't mean to sound pessimistic, but the Sustainable Development Goals for anyone listening today continue to be a priority. And as our Secretary General, Antonio Guterres, says, whenever the moment comes and this pandemic decreases and our global vaccine is actually adopted and disseminated, we have to build back better. And to build back better, digital health will be at the center of whatever we need to do. So with that, thank you again to all our panelists for taking the time, to AT&T, to Novartis, to Reach 22, and to all of you listening around the world. I sincerely thank you on behalf of the United Nations as of UNITAR. With that, this meeting is adjourned, and I wish you a good day. Goodbye.